Well, hello again. It's Debbie Gilbert here. I'm in Palm Bay, Florida today. We're doing our East Coast travel to meet Igot community partners and friends and members. And today I'm here with Don Zebraski, and today is your
Yes,
birthday.
it is. Yes.
So happy birthday to him.
Thank
Uh,
you.
Donald, I got to know you from our partner True Choice. You
Yes.
are an agent with True Choice.
Yes.
And we're going to just talk about some simple 101 kind of things about Medicare, just because one of our goals with I Got Communities is to educate our members so that when you get ready to make decisions about Medicare and Medicare plans, you can make an educated decision. You're not just calling the number on the screen. We always say, whatever you do, don't call the number on the screen, but educate yourself and then talk to someone you trust. So, Donald, if you could say one thing about Medicare to our membership, what would you want to say?
Oh, I mean that's obvious. Medicare, if it's changing, if there's been a real change with Medicare, you will see it in the news. If they start offering dental coverage, it will be in the news. It will not be some side story off of Facebook or off of Google. It will come from the news media. It's so different from, you know, what we grew up with, where when you saw stuff, you took it as information and this was fact. Whereas what you see on the internet, what you see is marketing companies with a mass appeal. They are reaching out, trying to get the attention of people. And what they actually are selling is phone calls. They call it clickbait. They want to put something in there that sounds so good to get your interest to call. And then you call and you find the agent of the week who may or may not be experienced, who may or may not have your best interest, especially with the way some of the companies drive for that. That's one of the joys at True Choice, is they give us the flexibility to make sure that we are working for the customer's best interest. We're not driven on you need this number. And I believe that, like Ms. Debbie said, talking to someone you trust is going to be the key when it comes to your Medicare, and watching those things that are going to lure you away with something that sounds too good to be true. Uh, they can get away with those, the marketing companies, and believe me, if I could change it, I would. I've already written bills, that are sitting up at the House Appropriations Committee for some Medicare revisions that I hope go into law, in my lifetime. But I'd love to see more regulation on what's the way some of these people market.
So, when you said if Medicare is going to offer dental, that will be in the news headlines, not on an advertisement. So, we do know that there are plans that offer dental. So, can you clarify that just a little
Sure.
bit?
So there are Medicare health plans, Medicare Advantage plans that are going to have a variety of benefits. Um, what I was referring to earlier is, those advertisements where you feel like you can get it separate from the plan, that you can keep what you've got. Listen, Medicare Advantage plans are a great option, and more than 1/3 of our seniors and people on Medicare are using Medicare Advantage plans. It's a great way to keep your costs down and get access to benefits like dental, vision, and hearing. But it is tied to the plan, and you're working with the benefits associated with that plan. Again, I sell a lot of plans in that area, and people are, it's a great option. But the idea of, I want to keep my plan with this company, Company A, and I want to get just dental, that's just not out there. They're not, there are plans that sell that, but they're not, Medicare's not giving it away. So an advertisement that says call and get free dental implants is most likely the key. What I tell people is, did you see the name of an insurance company? Did you see the names Anthem, Humana, United Healthcare, Cigna? Did you see one of the big companies in the advertisement, or are you just seeing, them talking about a benefit without a company?
Yes. Okay, so let's just give a basic information on when do you sign up for Medicare and who signs up for Medicare?
Sure. So typically for Medicare, there's a couple different ways. The most common way is by turning 65. And you can sign up typically 3 months before you turn 65 is when you're allowed to start picking a plan. So you'll want to start communicating with Medicare about 2 months before that. So maybe about 5 months before your 65th birthday, a good time to sign up for Part A, usually free for people that have worked 10 years. They call it 40 quarters. Part B will have a premium. It's an affordable premium based on, what they're actually paying for you. They get decent coverage with that. But the other ways would be somebody with end-stage renal disease. They become eligible for Medicare immediately, but it starts after 4th month of dialysis. Anyone getting diagnosed with Lou Gehrig's disease is eligible for Medicare immediately. And then the other one is anyone who qualifies for Social Security Disability Income, SSDI, after 24 months of receiving SSDI. They are given Medicare Part A, and they have the ability to purchase Medicare Part B. There's a big difference to SSDI as opposed to SSI. Many people on disability are receiving SSI and wondering where their Medicare is. Medicare is not tied to SSI, just SSDI.
Yes. So, so people younger than 65 are on. They have a disability,
right?
SSDI. Now, if you decide, well, I'm healthy, I don't take medicine, because I've run into this a little bit.
Right.
What's the danger of not signing up for Part B and Part D?
Sure. So Part B has a penalty that goes with it. And so, if you're still working and have what they call creditable coverage, which just means as good as Medicare, it's okay to hold back on your Part B while you're working. But the key is there are restrictions on when you can sign up for Part B. And so those restrictions don't occur as long as you're still working. Mm-hmm. The moment you lose employment, then you're tied to, you can only sign up January, February, March, and it won't start till July. You may find yourself in need of the coverage without the ability to get it, and paying more for it when the time comes.
And if you don't sign up for Part D?
Part D also has a penalty. And even if you're not taking medications, I would encourage you to look at the plans that are in the area. There are some plans that are very cost effective that would outweigh the cost of paying a penalty down the line. If at some point you're going to need them and you're thinking, I'm 65, I don't need Part D coverage now, you're not wanting a Medicare Advantage plan, so you stick with original Medicare. If you go to sign up for Part B, you could find yourself paying extra every single month. And that's even more, the penalties are even multiplied for high income earners as well.
Exactly. So right now we're in a time period that's known as what we call OEP.
Right.
Will you talk about OEP just a little bit?
Sure. So the Medicare Advantage open enrollment period, and this is, I just want to clarify, it's for educational purposes.
Yes.
Right? Because it's not a period where they advertise or promote the changing of plans, but it is something that's available to you. It's your right for anyone that's enrolled in a Medicare Advantage plan. It's like a buyer's remorse period, really. You signed up for the plan, you talked to the agent, and boy, they made it sound perfect, and you find out, oh, you forgot to ask about your specialist, they're not in the network. Or, boy, I didn't remember him telling me this. So they allow one-time opportunity between January, February, and March to make a single change to your Medicare Advantage plan that allows you to, switch, maybe go back to what you had or look at other options. But it's a great opportunity. This is something that's new within the last couple of years. It used to be in the law years ago as well. They took it away for a number of years, but it did come back, I believe, around 2018 or 2019. So, but it's a great opportunity for people to be able to make sure they're happy with their plan. They've tried out the plan and something happened. They find out something, they don't have to wait until the following January. They don't have to wait till October to call in. They have an opportunity to make a change. And that's really just the government looking out for them.
And of course, we've just passed AEP, which is annual enrollment period. And so people with Medicare Advantage plans can look at the other plans that are offered, and they can make a change during that time period.
Yes.
If they want to. And then OEP follows that up. Maybe you made a change and you just think that's not what I thought it was going to be, and you want to go back to, like you said, your plan or something like that. What do you think are some of the biggest mistakes we can make when choosing a plan? Can we make mistakes?
Absolutely. You can absolutely make a mistake. And I think especially during the AEP season, there's a big demand. There's a lot of agents on the phone, and especially if you're calling numbers you saw on commercial as opposed to calling someone you know and trust. The people that are answering the phones, yes, they have the same credentials as me, but there's something to a part-time agent that works 4 or 5 months out of the year versus a career agent that's in the industry year-round, that's looking out, and I'm the one left to fix the mistakes that other people do throughout the year. There's plans across the nation that maybe offer money back, and it sounds great, and a consumer will be led by a single selling point. Oh, I can get $50 back. And then they go to the specialist and they find out that where they used to pay $25 for, now they're paying $50 for. And all of a sudden they're like, wait a minute, he told me I would get money back on my Part B premium. He didn't tell me I was going to pay more every single time I go to the doctor, and a hospital cost may be additional as well. So that's really going to be the key, is being able to make that change. Be careful of who you are speaking with. Debbie is great at Igot for what she does and the ways that she helps people, and I've spoken with her customers and her connections through Igot, but we certainly do our best to try to help people. And one thing that I would say is there are a lot of phone calls, and the people on the other side of the phone are not the same. My wife and I do this business, at True Choice Agency, and we've got a lot of people of faith, a lot of people with strong convictions there that what I'm doing has to be helpful for the person. That it's not about how many plans can you sell, it's who can I help.
And I think it's always do the right thing.
Yeah, my goal, and and I think my number one way that I look at this as a perspective for selling plans is, if I sell plans for a living, I fail all day long, because there's no way every call is going to be a sell. If I try to help people, I can do that on every call. And so that's helping people, is helping to educate them, helping them to understand what they're seeing on the commercial, helping them to differentiate between plan benefits and marketing ploys, helping people to compare plans. And oftentimes I find plans that give additional benefits, but oftentimes I let them know what you have is probably working out better for you, and you don't want to make that change. So it's good to have a fair and unbiased look, from somebody that represents multiple plans and is able to do a good review and come back and give you honest feedback. Look, I need you having better benefits more than I need a sale today, because the person I need to look through in the mirror is myself, and I got to feel good about helping the people that I talk to every day.
Exactly. I've got one more question about Medicare.
Okay.
Medicare supplement plans are different than Medicare Advantage plans. And Medicare, I know in working with some of y'all, Medicare supplement plans increase in cost annually. And there has been a lot of questions is, once I'm in one supplement plan, how hard is it for me to find a cheaper supplement plan? Can you answer that?
I love that question because, I can certainly compare Medicare supplement plans. And let me make this clear, and I tell this to my customers. If you're in a Medicare supplement plan and it is still an affordable option, I don't want to change it.
Exactly.
I'm not moving people from Medicare supplements to Medicare Advantage plans for the sake of moving them. There is nothing more complete and comprehensive in terms of protecting your cost for your health care than a Medicare supplement. But if you're wanting to compare, listen, I know we're across the nation with Igot community, so I love it. I know there are certain states like Washington State that is a guaranteed issue state. You can shop around all you want and compare prices. New York State is the same way, and Connecticut as well. Even Maine allows you to do that. Other states like California have a birthday rule. So if within 60 days of your birthday, you can shop around and you can change plans.
Every year?
Every year.
Wow.
Colorado, they've got the anniversary. So if you started your plan in July, regardless of when your birthday was or Part B, if you started your plan in July, that anniversary date comes around, you got a 30-day window in the state of Colorado.
And it's guaranteed issue?
Guaranteed issue. Everywhere else, it is a little more difficult because they are going to go through the full, complete underwriting process, health questions. We're going to dig into asking about what medications you're taking, how long you've been on those medications. Those all go on the application. Yeah. I've seen applications get stopped because height and weight ratio.
Yeah.
So
I saw that this year.
Yeah. So it can be a challenge. So it's important when you are selecting a Medicare supplement plan. Get the advice up front and find out more, because I can tell you there is one company that I represent that specifically appeals to 65, 66, 67, and I can see their price consistently among the lowest. Turn 68, 69, 70, and I see them consistently among the highest.
Really?
Yes. So I'm not going to mention any names here on the companies, but I'm going to tell you that these insurance companies, you want to make sure that you're getting a plan that's going to have consistent growth over the years, that you don't get bumped out by significant increases over time.
I had another question about that just flew out in my head and out of my head.
That was kind of a shocker on that one. I
know.
Through your thought patterns.
I'm glad to know that. Oh, yes. Here's the question. So, is there ever a time when you have a Medicare supplement that it only makes sense to go with a Medicare Advantage?
Absolutely.
When would that be?
So the Medicare Advantage, it depends on where you're at in the market, right? The Medicare Advantage plans are designed to be competitive in your area. So you can see a great fluctuation between plans. And an area that they compete with in more competitive markets is going to be what they call the maximum out-of-pocket. And I have helped somebody that had a Medicare supplement that was paying $280 a month for their Plan G. And I moved them into a Medicare Advantage plan. Again, not something I generally do, but the maximum out of pocket was $2,900.
Yeah.
Their maximum out of pocket, their worst case scenario with the Medicare Advantage was better than their best case scenario with their plan of just paying the premium. So, if you're in an area where the Medicare Advantage plans are not competitive and your maximum out of pocket is $6,700, $7,200, I'd be very leery in leaving those plans. The bottom line, insurance it's the transfer of liability, and you're paying that premium to not be responsible for it, and you've capped your cost with a Medicare supplement. And going to a $0 Medicare Advantage, you are increasing your liability. And if you're going from your worst case scenario was, $3,500 with the premium cost for the year, and you switch to a $0 plan with a maximum out of pocket of $6,700, at the end of the year, you have a difficult year and you've spent $6,000, and you're thinking, if they would have just left me alone, I would have only spent $3,500.
And I think the other thing that we have to consider with switching from Medicare supplements to Medicare Advantage is if your financial situation changes greatly.
Yes.
That can happen when various things happen in your life. Then all of a sudden you don't have the money to.
Right.
You're either going to have to pay for your supplement plan or your groceries.
Right.
And at that point in time, you would need to probably consider a Medicare Advantage plan because we do have to eat.
Right.
And so there are lots of things that can happen to us as we age. But one thing that to me is very important is take the responsibility yourself to educate yourself no matter what it takes. And the greatest thing I love about True Choice is we have at our fingertips some of the best Medicare educators that we can have anywhere. So I'm so thankful for that because, I feel like that people perish for lack of knowledge.
Right.
That's
yes,
just a
absolutely.
scripture. We perish if we don't have the knowledge. And so one thing for sure, you do not get too old to learn. And you can learn how to take responsibility and care for your own medical health, your well-being, and your Medicare insurance plans too. So anything else you want to share?
I just want to share this, and and that was kind of where I started with the Medicare supplement, was if it's an affordable option. So that's one of the keys. I also want to say this for the Medicare supplement people out there. The annual enrollment period, AEP, from October 15th through December 7th. You think you've got a Medicare supplement, it doesn't apply to you. I can't tell you how many people I've talked to that picked their Medicare prescription drug plan and left it alone. And it breaks my heart when I've got somebody that is on a tight budget that is paying $115 a month for a standalone prescription drug plan when the national average is $32.74.
Exactly.
Shop around for that prescription coverage. I understand agents don't like to talk about that. They want the Medicare Advantage. They want to convert them. Listen, they're obligated to help you. If they're not helping you, call directly to the companies, and they will have call centers where they can help you look at your prescriptions. You want to look up your prescriptions. You have the ability to change every year. You've got to find what's going to be cost effective and look at not just the cost of the drugs, but the cost of the plan as well.
Yes, and your prescription drugs, they change every year with
Right.
your health. And so I agree, Donald. It's as important to look at what we call a PDP plan or prescription drug plan And that is one thing that True Choice is glad to help with always.
Yes, absolutely.
So, well, thank you. Happy
My pleasure.
birthday.
Thank you.
Thank you for having us in your home. And thank you for joining us. And until I see you again, just keep living.